You talk about, there's a difference between mandatory spending and discretionary spending. Right now, the numbers are about 1070. That's $1,070 billion is what this budget will look like somewhere this year. But of that, the majority of that money that's spent for mandatory, it looked like a Pac-Man. Years ago, 30 years ago, if you look at the Pac-Man, about 1/3 of our budget was used on mandatory spending. Today, it's reversed roles, and it's now 2/3 of our budget is used on mandatory spending. In the next 10 years, it could be close to 100% of our budget used on mandatory spending, which is Social Security. That means no defense, that means no other programs within the country. So those are the type of numbers. And I wish I had the little slide, one of these PowerPoints that was provided to us just before I left this last week on these numbers. It would have been great for you to see. It was awakening for me.
Thanks for your answer. We can disagree agreeably on that one. If Congress has the backbone, I think Congress can raise the amount of money, income level, make it $1 million, make it 250. As you know, when there's more employment, Social Security fund goes down. When there's more unemployment, it goes down. When unemployment is up, the fund goes up.
Interesting you bring that up. I'm an employer, ex-employer. 21 years in that business. You know what? The reason I'm here today, people say, oh, regulations, we need regulations. We do need regulations. Last year alone, this administration pumped out 82,035 pages of new regulation. 82,035 pages of new regulation. What were you doing on Christmas Eve? Well, regulators pumped out 496 pages on Christmas Eve. What were you doing on New Year's Eve? The regulators pumped out 298 pages of new regulation. That's almost 350 pages a working day that you would have to hire somebody to do. So government is overreaching and causing the economy. It's not a matter whether it's rich or poor. We had a strong economy and we were moving for a strong economy, but we continue to want to increase spending that should be spending at the state levels and let the states compete rather than the federal government taking on roles that they were never authorized.
You can reduce tax expenditures. So.
What's your other question?
I looked up your age.
Just 1 second. I want to make sure I'm clear. Not that I'm taking over here. It's a good answer. But if we're going to set the precedence and have two questions to every person, I want to make sure I'm fair to everybody. So if you have 2 questions or at least 2
This will be a quick one.
It goes back to the original question?
It goes back to
3-part one. Thank you.
Congressman Hardy. I looked at his age, so it doesn't apply to him, but it applies to other members of Congress. As I said, the full retirement age for Social Security will be age 70. However, members of Congress can retire with a full pension at age 62. That ain't right. There's an old saying about the minister who says, don't do as I do, do as I say. Right now, your health care is not in the federal employees fund. You can take your pension fund out, pass a law, which I doubt will ever get done. You can pass a law to change the retirement age so it matches Social Security. Then we know that members of Congress care.
Okay, thank you, Norm.
I'll check on your facts because I don't know if that's true or not, because I heard lots of facts before I got to Congress about people were accusing me that my retirement, I only had to serve 1 term and I got full retirement.
2 terms.
That's
5 years.
5 years before it vests. Vests just like any other government employee. You'd still have to be there 30 years to get full employment benefits. Any other government employee. I heard that I had special health insurance program. Guess what? I'm on Obamacare just like everybody else. I know what mine is for mine and my wife. $1,872 a month for me and my wife, and I'm pretty healthy. It's because I'm in this weird bracket over here. That's fine. But if we are at 62, that is against the law. Congress has laid before itself no laws that aren't the same as those that we the people.
You can look at your stats and look at the Veterans Reserve Service
Trust me,
report.
they will look at it. Thank
All
you.
right, so we have several
Last year.
people here in the audience who want to ask a question. I'm going to go ahead and kind of get a cue. We're going to start, I'm going to start in the very back with the ladies and then work my way up here. What is your name in the back? Yes, ma'am.
Julie Dom. And
Julie and
Debbie Pack.
Julie,
I
Debbie.
really do have a Medicare question. I don't want you to miss me just because I was a mouthy girl.
Not a problem. I'll get to Julie, Debbie, and then this gentleman right here. Gentleman right here in the polo shirt. Yes, what was your name?
Bill Lee.
Bill. Okay, so we're going to start with Julie. Go ahead, ask your question.
Yeah, my mom has advanced Alzheimer's. And when my dad died, I had to retire early and move here to take care of her from California to here. She got very little Social Security. They took my dad's, a bunch from his, and then some from hers, and gave her this little bit less than $1,500 to live on with Alzheimer's. So I had to move here. I was already paying their house payment, working 2 jobs. Now, the veterans, she gets very little from veterans, and now they're taking her cost of living raises from Social Security and deducting from what they were giving her. Do you know that's happening? And her medicines are going up. And for the last 3 years, they say, I owe them money because she got cost of living raises, even though her medicines have gone up every year. And now they're deducting it and giving her a lot less per month. And I'm already paying most of it for her.
Very good question.
It costs a lot of money for an Alzheimer's. For care, it's $4,500 to $11,000 a month.
Oh my God.
So that's if you look at that anywhere for an advanced Alzheimer's patient.
And if I'm not mistaken, I think, would you like to start, Mr. Phelps? Is that something that's directed towards you, or should we go to Ms. Wiggins?
I don't think it's right they're taking her cost of living raises.
Sure. Okay, Mr. Phelps is going to begin.
With respect to calculation of Social Security benefit, the agency's formula is a high 35 years. So the highest 35 years of earnings are indexed for inflation. So for example, if somebody made $10,000 in 1975, those earnings would be indexed for inflation, and those $10,000 in 1975 may be worth what they will be worth what they are now. Let's say $30,000 for the sake of ease. So the high 35 is our starting point with respect to the calculation of any Social Security benefit. The reason why indexing is important is it allows for the benefit to keep up with inflation. So in the case of a survivor, the payment, there's some variables that are involved. Insured status is our starting point. If the deceased acquired their benefit or were awarded their benefit at full retirement age or later, and the survivor also was either not insured, or if they were insured on their own record, was awarded their own retirement at full retirement age or later, then the benefit payable in a survivor situation would be 100% of the deceased's primary insurance amount. And that's standard across the board. There isn't one formula for one group and another formula for another. That's a standard formula across the board. Now, if benefits were taken reduced, meaning that a person can voluntarily choose to take their benefits early before their full retirement age, they do so at a reduced amount of money. That reduction also carries over from life into a survivor situation. So there are several variables involved with calculating a survivor's benefit, but that's our starting point, is the primary insurance amount, which is the amount that's payable at full retirement age. How it would be different from one person to another is at what point in time did a person choose to take their retirement? Was it at full retirement age or later, or was it prior to that?
It was full retirement, and they did not give her the 100% of my dad. My mom was just mostly a stay-at-home mom. She worked very little, so they gave her a lot less than what they were making together. She only had, I think, $300 a month of their own coming in.
What I encourage you to do is set aside some time, visit your local office, and we'll be happy to look at the record.
Okay. And what do I do with the veterans are really screwing with us? What do I do with that? I mean, taking away her, every year I'm running out of my savings.
I would have to defer to the Veterans Administration. I don't work for that agency, and it wouldn't be a problem for me to address that agency.
All right, thank you.
Someone here from VA. Are you here from VA?
No, I'm Deputy District Director, so I deal with a lot of the VA military issues for the congressman, so.
So it sounds like that, is it Debbie? No, Julie.
Yeah.
Hi.
Hi.
Janice Wiggins. So how our office may be able to assist, everyone's situation is different. And so you've given a lot of figures and numbers, but if you contact our office, we can take a look at exactly what your mom's income is and see if there are any state programs that may be able to supplement. And then it sounds like the congressman has liaison constituent services with the VA as well. I am aware of a VA program called the Aid and Attendant Care Program. And so I'm wondering if you're accessing that program.
Well, that's what it is. They're taking away from her aides and attendants. My dad was a World War II Marine for 4 years on the islands. He got aid and attendants when he was in his 80s. He never wanted to use any benefits till he absolutely had to. And then she got part of that. It took 3.5 years and Senator Harry Reid to get it for us, but we got it. We got a little
There's
bit.
also, though, another state program as well. It's a Medicaid waiver program, and I'd like to talk to you more about that because are you the sole caregiver for
Yes.
mom right now? Okay. So I'd like to talk to you about respite care as well, because if you need to go out, grocery shop, do other things for yourself, go to your own medical appointments and visits, then there may be other caregiving services that can come into the home to help you out so that mom is not home alone. And I empathize with your situation because my husband and I work opposite shifts to care for his mom, who's 83 years old and also has Alzheimer's and dementia. So I understand that situation and that dynamic. And so I'd like to talk to you more about your mom's specific situation and see what the details are, because every person's situation is really unique and different.
Okay. I think I wrote down your number.
I'm at 702-486-3587. And we're here locally, but just as the gentleman from the SHIP program said, we can do a lot via phone. So you don't necessarily have to come into the office.
That
If
would
you have
help.
access to the internet and maybe even fax or email, then we can do some things that way as well.
Thank
And
you.
so I have a few brochures that I brought here, and I have some business cards, and you can see me afterwards.
Okay, thank you very much.
Julie, it sounds like you've got a few extra questions in there, but if you need another follow-up question right now.
Oh, no, I'm
Good.
good. I got some cards
One-
already.
One quick comment to you, okay? It sounds to me also as if she would qualify for Medicaid at
that's
some
us.
level,
I'll talk
along
sure
with
about that.
Medicare, to deal with any of the medical expenses.
That's what Mr.
So,
Yeah.
SHIP would be the one to call on that, or the state agency. You can do it all in one call. They will also take care of it.
Okay,
Okay,
thank
and
you.
answer your questions.
So what we got out of that is you make one call and you get it all. I heard that, okay. Thank you very much. Good, great answers. I believe we have Debbie up next?
Yeah.
Yes.
Hello, I'm Debbie Patton. I wish Councilman Churchill was here because he always tells me, Debbie, stand up. So I'm standing up. My first question is really a general question. Are you going to be changing the Medicare card itself in the near future? Because with all the identity theft and the high-tech fraud out there, you have a card with your social security number on it. I mean, you lose that, anybody, so I just want to know, because this is the times we are living in. And nobody, I don't have any identity with my social security number on it,
You don't carry
except for the Medicare card, and why, so I'm just asking the congressman, maybe this is something that they could change the card on, because anybody who loses it, you know, we're in,
Sound like something,
I think
that's the Medicare card.
sound like something maybe you should look into. I think we have experts who know something about card changing.
Yeah.
At present, there are no proposals to make any sort of significant changes to the Medicare card nor the Social Security card.
But why, my question is, why do you have the social security number on the Medicare card when it's just a little piece? You could give us another card and without our number on it.
As the Social Security Act and Medicare legislation is presently constituted, the Social Security number with an identifier which corresponds to the type of benefit, so the type of Social Security benefit a person receives, as it's presently constituted, that's the identifying number.
Okay, thank you, thank you.
You're not supposed to carry that card around.
That was gonna be that's a great follow-up question.
No, you have to carry the card.
No, you don't.
That's a great question. Can I have your name in the back?
Oh, my name is Iris.
Iris just mentioned that, for those of you who didn't hear in the back, she said you're not supposed to carry, well, most of you may not carry it around. I know I don't carry my social security card around.
Definitely. There's another system program to SHIP called SMP, which is Senior Medicare Patrol.
Well, hold it. I want to make sure that Iris can hear this in the back. Go ahead again, I'm sorry.
Okay. There's a sister program to SHIP, which is Senior Medicare Patrol. It is again, federally funded but state-operated program that assists seniors in checking, number one, checking for fraudulent type things in their health care. And one of the premises that they push strongly is protection. Okay, that's the first stage. And one of the protection items is do not carry your Medicare card with you in your wallet or pocketbook. When you have to go for medical procedures, take it with you. Otherwise, don't take it with you. Okay?
All right, I see a lot of other hands, and I'm going to get to them, but I know I promised Bill first, but what was your name, ma'am, right here in the...
I had a reaction to the Social Security and the Medicare card.
Okay.
A real live agony.
Okay. Well, maybe well, I don't want to...
Go ahead.
She can go ahead. That's a gentleman right there. Do you want to go ahead and ask some questions in reaction to this?
Okay, it's almost not a question, but the only time we have ever used our Medicare cards, doctor's offices and hospitals. And believe me when I tell you, my husband's Social Security number was stolen either at a doctor's office or a hospital.
Oh my God.
And we were ripped off. We even had somebody apply for our income tax 2 years in a row. We met with federal agencies, federal government, they were all very helpful. And, but it was, and I asked my doctor, I said, why do I have to give you this card? It has our Social Security number on it. He said, if I don't have that, I can't treat you. Now, gentlemen, what's the problem?
I can answer it. There has to be some sort of universal identifier for a human being. There's all sorts of services that you receive. You have a passport, you have Medicare, maybe you have state services, whatever it may be. There needs to be a universal identifier. In the US, that has traditionally been based upon the Social Security number. Now, other countries have what's called a national ID, but it really is the same thing because everything is related back to that number. So it doesn't make sense, it doesn't matter what the number is. If you have a universal identifier, whatever it may be, it is going to cause risk of fraud to you.
Sure. Thank you.
Can you
Bill?
put me on the list?
Yeah, absolutely. As soon as I get done with Bill, I'll get it on the list.
My name is Bill Lee. I live in the Old Farts community across the road. Real fast, I'll keep it under a minute. First of all, to you as a senator, I know it's an aside point, I've been pushing the Dignity with Death bill, and in Nevada, you have so much conflict of interest. The guy that's in charge of the health committee in the Nevada State Legislature is a guy named Hardy. He should recuse himself because he killed the bill in committee for Dignity with Death, which would save all of us a ton of money. Okay, at a state level, that's not a federal issue.
Right, and that's your statement, but that's not your question.
No, that's a
It's a
comment.
statement. You got it.
Okay, there's 2 points here. I'm trying to get revenue for our congressman. Are you aware, Congressman, of earnings stripping?
What's that?
Are you aware of earnings stripping?
No, no.
Okay, just a real fast one. When you have inversion companies overseas, okay, that people like Pfizer are moving out, we've had Apple over there. Okay, those companies have their headquarters overseas. What they do then is they take their US subsidiary, okay, and loan them the equivalent of their net sales. But then that as a loan is written off as a capital loss, so they don't pay any income tax. It's called earnings stripping. In 2004, the latest data in the United States was $700 million was stripped. And I'm aware of it personally because I worked for a company called Xerox many, many years ago. And it's set up with what they call transfer pricing. Okay. So with the earnings stripping, it's not the big thing that Congress is worried about on the inversion incorporation. It's the fact that, yeah, they're not going to pay taxes over there in Ireland, but then the U.S. subsidiary borrows $40, $50 million and writes it off against their income tax, and hence they pay no income tax. It's called earnings stripping, but I think it's something that, I don't think you're on the finance committee, it's something.
I'm not, but these kind of issues really need to be solved at the IRS level, because we can't continue.
But you could submit a bill, you could go to the finance committee and, because all they're worried about is the inversion. I have not read anything about earnings stripping. The second point, and I think I'm a little over a minute, I apologize, is I worked all my life, and I'm an old fart, and I get Social Security now. I enjoy that. I think, though, that Congress should set up a bill in regard to the earnings limitation on Social Security. To wit, if you have unearned or earned income, and I'm going to make a number up, I'm pulling out of my butt, $150,000 a year. It could be $250,000 a year. But if you make that kind of money, that's the Social Security Administration to turn around and, because it's a contributory fund, take some wealthy, I don't know who they are, millionaires now, that are Social Security, it's like Donald Trump, and he's paying Social Security, getting Social Security. Buy him out on his contribution, because the company matches it. So then that would save a ton of money, because then the liability of Social Security wouldn't be there. You know what I'm saying?
I understand.
Okay, so you'd buy those people out. Because somebody making 150 grand a year, earned or unearned, doesn't need it. I don't think. The number might be $250,000, but I think that would save a lot of money for the state.
Excuse me, so somebody's gonna determine, okay, this works for you, but it doesn't work for you. Who's gonna be that God? And the fact of the matter is, a lot of people.
Corporations do it every day.
Oh, no, I understand that.
Yeah.
But
I'm thinking.
Let me jump in here.
Okay.
AMAC actually, that plan they come to us with, kind of solves that same issue in a different direction. And we'll wait and see where that goes and how the numbers come out, but it's kind of a, right, you want to try to take a little shot at it.
Yeah, so Donald Trump, I don't think he should get Social Security.
Yeah.
He can get what he contributed only, but the benefit after that, screw him.
If I may, it's kind of a tough line you have to draw, because you don't want, everyone's been paying into Social Security their whole life, so the last thing you want to do is tell someone who's contributed their whole life that they're not entitled to something that they've been paying for.
Absolutely.
And a lot of them have been big contributors, whether through payroll taxes or other benefits. What we want to do with AMAC is find a common sense approach to fix Social Security. It's kind of a three-tiered approach. I'll try and do it as quickly as possible, won't go too detailed. Someone already brought it up. Eventually, we're going to have to raise the retirement age. But what we want to do is we want to phase that in over between 12 to 20 years. There's people who've been planning for retirement who are 45 and older, who are banking on having 65, soon to be 67, as their retirement age.
7.
Yeah, it will soon be that if we don't do something soon. But, I mean, Social Security is going to go roughly bankrupt in roughly 13 years. But at the same time, we need to keep, AMAC's plan is to keep the early retirement age at 62 while increasing full retirement. There are labor workers, people who do hard jobs who have to have the 62 years old. They can't continue to do their hard labor past 65. So we'd have to raise the retirement age, phase that in over a period of time. Secondly, what we'd like to do is guarantee a cost of living adjustment, but at the same time do a cap of cost of living adjustments. I was just on the phone today with Dan. We did a study of the last 40 years of COLA, or 30 some odd years of COLA. And in the late 70s, there was COLAs of upwards of 14–15%. Those days are long gone, in my opinion, and we were talking about that. But you can tier the approach. Those who are the elderly poor, making less than $20,000 a year, you can guarantee them a cost of living adjustment of 3%, capping it at 4%. You can save a lot of money if the cap is, or if the COLA that year is over 4%, by cutting those benefits down. The higher earners, those making 50 or above, guaranteed COLA of 1.5%, cap at 2. Those in the middle, COLA of 2%, cap of 4.
what we want to do is give consistency so people can guarantee the fact that they're going to get at least a 1% COLA, or at least a 2%, or at least a 3%. You can bank on that every year. And then if there's extra COLA, at least you'll have that, and you'll be able to get the maximum of your benefit in the bracket which you fall. And then lastly is incorporating private savings accounts. The idea is a lot of times people want to have full autonomy over their money, and a lot of you will care a lot more about where your money goes if you have full autonomy over it. So we want to add a private savings mechanism called an early retirement account to the Social Security to help subsidize the cost, so that in addition to your Social Security benefit, you can be upwards of $200,000 in a private account too. So at 62, you can get at that account. It's called an early retirement account, and I'll defer because that's.
Well, why can't you just pay them off? Because the entitlement part would be what you put in, like a, for want of a better word, the expected benefit if you're a millionaire. Okay, they don't need it.
I think,
Why should somebody get $2,500 a month or $2,800 a month that is making $250,000 a year? Buy that person out, whatever he contributed over his lifetime, and say, I'm sorry, that's it.
Where are you gonna
Because
get that money?
the money, if you did the modeling on it, the money would be astronomical.
okay. I mean, that's an idea, and again, we'd have to have the CEO look at anything before we'd say that this is actual savings. But just speaking on behalf of AMAC, I'm very uncomfortable with saying that someone does not get their benefits.
That's right. They're getting their benefits though.
Yeah.
And we can return to this after everybody else has had a question, so we can come back to it, Bill. Now, there's some others out there who raised their hand, and so we'll go, your name, sir?
Bob.
Bob? Bob, and then who else wanted to ask a question? And your name?
Terry.
Terry? Anybody else? I thought I saw it. We've already had Norman. Is there anybody else that want to ask a question before we go back to Norman? Okay. So we'll go with Bob, then Terry, and then the gentleman, what's your name?
Doug Shanholz.
Doug? Okay, and then we can go back. If nobody else has any questions after that, then we'll go back to Norman. So we'll go over, Bob.
I find it kind of interesting. Debbie asked a question about the ID card, and I think it's very interesting. When I enlisted in the reserves years and years ago, I got a number from the military. Many years later, I got a commission. I got a different number. That number disappeared. Then for a while, it became a Social Security number on the retirement times and things like that. And about 5 or 6 years ago, they changed the number to something that is entirely unrelated to anything on this thing now. Don't tell me we can't get numbers that are separate numbers, because the government's given me 4 different numbers over the period of time, and my thing is not related to my Social Security number. Now, the Social Security number, if I remember correctly, was only supposed to be given for one thing only, and not used for everything that you ever do. You go to a doctor, you want to get a credit card, everybody wants that Social Security number, which Debbie made a point, and you made a point, people rip the people off. Now, this is totally ridiculous. You can have different numbers for different things, like the shift thing you were talking about, I think, you know. But I had 4 different government numbers, all right?
I'm not sure I got a question there, but I did get the statement.
It was a statement.
What you need to understand, though, is that linking all these numbers together is a universal number, which is your Social Security number. It is behind the scenes,
So they got rid of it on the government ID card.
but that does link back to your Social Security number.
Well, that's
There
fine,
needs to
but
be,
when I take my government ID card, then somebody's gotta work and get that done.
when you take it to the agency for who issued the card, or for what purpose the card was issued, that's fine, but that links back on a computer system somewhere to your universal ID, which is your Social Security.
Which was never supposed to happen in the first place.
It's not, but think about, look
I
at it
know
from
what
the,
you're saying.
yeah, but look at the perspective of, we're now talking about having health care where you can go anywhere in the country, and your health records would be available with your permission by any doctor or hospital anywhere. In order to do that, you need a universal ID, okay? And right now, the universal ID is your Social Security number. If it were a separate number called your health care number, somewhere that would link back to your Social Security number because of the billing component of it, you know, to the insurance or the payment to the the providers of the service.
That would be a Medicare Advantage card. which
Yeah,
also-
again, I'm a computer guy. I started with IBM in 1965, so I'm aware of how all of the complexities of this come together. And I've done work overseas for other governments in looking at universal IDs. It is a major problem, and it is a definite security problem, and the government is going to have to find some solution for it along the way.
Thank you,
Sorry.
Mr. Earl. No, that's great, thank you. I'm going to go over here to Terry.
I want to make a statement first about the social security card. I know all of us have children and grandchildren that don't have those Medicare cards, and you do not have to provide it to a doctor or anybody. So when they're sitting down filling out paperwork, they do not have to provide their social security number to anybody. Now, Medicare. I pay every 3 months, and up until December, it was $314.70, and in January, I got a bill for $365. So did everybody get a raise in their Medicare bill?
You're talking about supplemental insurance.
Medicare.
No.
No,
She is
I'm talking about
the
my
104.
Medicare payment.
You want to answer the question?
Yes, I can take that. Because of the lack of COLA, the cost of living adjustment this year, it triggered a provision within Medicare to where it's called hold harmless. So if a person receives Social Security benefits and they receive,
Don't.
well, I'm getting to your specific situation. The standard premium in 2015 was $104.90. If a person is awarded and receives a Social Security benefit and receives Medicare based on that benefit, attainment age plus entitlement to a Social Security benefit, the premium stayed the same. If a person does not receive the benefit, or if they became entitled to retirement or another benefit, in 2016, the premium increased to $121.50 during this year. So those that were receiving benefits prior to 2016, the premium stayed the same. The reason why is there's a provision within the Social Security Act that when the COLA wasn't given, the premium stayed the same. But those that are newly entitled or do not receive a benefit yet, in 2016, the premium increased to $121.50.
Okay, so if I don't receive Social Security, that COLA didn't apply to me.
That's
So
correct.
could I talk to
That's
you
why,
about
that's why your premium went up. Had you received a retirement benefit, it would have stayed at $104.90. If you'd received a retirement benefit prior to January, had you been entitled to a benefit in 2015 or previous,
I don't get
it would
Social
stay at
Security.
$104.90.
I don't get Social Security.
Why
And that's why it went up.
So it went up because I don't get Social Security.
Correct. You're not part of, you're not included in that full harmless provision.
Okey dokey. Thank you very much.
There are a bunch of us who don't get it if you were.